Parts of the immune response from natural infection or vaccination, this is no more than the beta variant. Furthermore, evidence from the United Kingdom shows that vaccines remain effective as long as the full vaccination schedule is received. Kusho ukuthi leli gciwane njengoba liziphenduphendula lizama ukubalekela imigomo nemithi lena sizama ukuthi silijahe ngayo. Kodwa kuyacaca ukuthi uma ugomile usethubeni elihle lokuthi uvikeleke. Kusho ukuthi imigomo lesithi sicela abantu bakithi ukuthi bayogoma iyasebenza ukulivikela leli gciwane noma ngabe seliqhamuka ngayiphi indlela. Ingakho ke we would like to join the president and all the ministers in calling for observance of all the health and safety protocols. Let's continue to wear our masks in public. We must regularly wash or sanitize our hands. We must always keep a safe distance from others. Unless it is necessary, please remain at home. If we are sick and even have mild flu or COVID-19 symptoms, you must isolate yourself, including from your immediate household. Ngiyathanda ke nokuyisho lento ukuthi siyabonga ukuthi amanyuvesi akithi amanye awo yiwo aphambili ekubhekaneni nendaba yokubhekana naleli gciwane. Okusho ukuthi ama-university akithi lawa umsebenzi wawo nje akuwona ukufundisa kuphela, kodwa umsebenzi wawo omunye ukwenza uphenyo nokujula okwenza ukuthi kukwazi ukuthi kutholakale amakhambi okubhekana nezifo ezinazo. I do wish to emphasize this, that the role of our universities in funding, of some of our universities in fighting COVID-19 has been phenomenal, which shows that our universities, much as they are centers of teaching and learning, they are also research centers who are actually able to work towards finding solutions to the many health problems and challenges that we have. That is why it is important that we defend and protect our universities as places that are very important for the security, safety, and health of our population. Now I turn to higher education and training matters. As you may recall, on the 29th of March 2021, I released directions in the Government Gazette to provide a national framework for guiding public and private higher education institutions in managing the 2021 academic year during the continued COVID-19 pandemic. These directions were shared with all public and private institutions and have provided an important basis for discussions on how institutions should manage the 2021 academic year in the face of the many challenges of the COVID-19 pandemic, its effect on operations, teaching and learning and research activities, with the aim of ensuring the protection of staff and students across the sector. Our main concern still remains the safety, wellness, and protection of our staff and students in all our post-school education and training institutions. Into ephambili kuthina siwumnyango ukuphepha kwabasebenzi nabafundisi nabafundi kuzo zonke izikhungo zethu zemfundo ephakeme. The following directions should be read with the relevant COCTA regulations released from time to time, the latest of which were published in the Government Gazette number 44772 on the 27th of June 2021, following the President's announcement last Sunday. The President of the Republic of South Africa, His Excellency, Mr. Matamela Cyril Ramaphosa, publicly announced on the 27th of June that the country will go into an adjusted level 4 lockdown from Monday 28th June 2021 for a period of 2 weeks. The President announced that all gatherings or meetings are prohibited and that schools and other educational institutions will be closed for at least 2 weeks, and contact classes in tertiary institutions will be closed this week with access to buildings closed. Residences, however, will remain open. and many of our institutions will continue with teaching and learning through remote means. Following these restrictions and measures, I requested Deputy Minister Bhuti Manamela to urgently convene our ministerial task COVID-19 Post-School Education and Training Task Team, comprising of our universities, college principals, labor unions, TVET college students, university students, to discuss and provide inputs on an optimal plan to manage institutional mandates under the new restrictions. Sizokhuluma nje namhlanje asizikhulumeni into esuka emakhanda ethu. Sicele isekela likangqongqoshe wethu uBhuti Manamela ukuthi abize umhlangano yabo bonke abathintekayo ezikhungweni lezi ezingaphansi komnyango wethu okube nomhlangano esikhathini okungekudala njengomsombuluko bakwazi ukuthi kwahlangana kwaxoxwa kwaboniswana ukuthi njengoba leli gciwane ngathi liyavuka futhi manje sizosebenza kanjani ngokubambisana ukulwisana nalo. Izinto esizozisho namhlanje ezinye zezinto esizixoxe lapho. On the basis of these consultations and inputs, I would like to announce the following measures applicable to the post-school education and training sector during the current phase of national lockdown restrictions. Universities. The principle outlined in the higher education sector directions is that all our universities will manage their own academic activities in line with the national directions and health protocols with the support of our own institution, Higher Health. Institutions are expected to ensure their COVID-19 task teams are functional and active during this period, to manage institutional responses to the pandemic and maintain effective communication and consultation with staff and students. The new directions provide guidance on the following matters: institutional plans, campus health and safety, student accommodation and residences, psychosocial assistance for staff and students, academic classes and examinations, graduation ceremonies and events, international students and international travel, and vaccination. In terms of the adjusted level 4 lockdown that has now been put in place, our universities do not officially close, but all face-to-face teaching and examinations must halt for the next 2-week period. Learning will shift exclusively to online learning for all students. Residencies will remain open, as it is also not safe for students to travel back home at this time, and it is necessary for students to retain access to campus and residence-based Wi-Fi. However, universities need to continue to manage residences according to the necessary health and safety protocols, as outlined in the directions and in line with protocols developed by Higher Health. Sithi amanyuvesi akithi asizuyivala indawo ezihlala abafundi. Nokufunda kuzoqhubeka kodwa kuqhubeke kusetshenzwa ngamakhompyutha. Kodwa ke siyacela ukuthi indlela lezi zokuvikela leli gciwane siqhubeke nokuthi sizigade. Siyacela ukuthi kungabi nemigqumo nemgidi esingekho isidingo sokuthi ibe khona ezikhungweni zethu la sihlala khona, ngoba leli gciwane lalisizakala khona kakhulu likwazi ukuthi lihambe yonke indawo. Under no circumstances should any mass social or other activities be permitted in residences or on campuses during this period, and institutions are requested to strictly enforce restrictive measures. In strictly enforcing these measures, we request everyone to cooperate and to work together for the sake of our lives, all of us, staff, workers, students, and other people who are benefiting or who are part of our institutions. It has also been agreed that international and interprovincial travel will be discouraged and limited to essential services and needs. There will be controlled access to campuses for essential services and other activities that cannot be suspended at this time. As many staff as possible who can do so should work from home. Those who are able to work from home, of course with arrangements with their management, we encourage them to do so. The sector will continue to be guided by the 29th of March 2021 directions and the 27th of June COCTA regulations. On TVET colleges, until all colleges are officially closed this week and upon reopening after the lockdown period, all social distance, health and safety protocols will be strictly adhered to at all campuses, including residences, which will also remain open with TVET colleges. This includes, but is not limited to, sanitization, social distancing, wearing of masks, contact tracing and phased-in contact classes, as guided by the Ministerial Advisory Committee and other relevant parties. That's the Ministerial Advisory Committee of Health. I hope I am right, Ishmael. Colleges will initiate hybrid, that is remote, teaching and learning approaches as was done in 2020, and further details of this and amended opening dates for our colleges will be communicated by colleges themselves in detail in due course. We request both staff and students to be closer to their colleges so that they know at all times what is happening. The Department of Higher Education and Training, together with the College Principals Organization, is in the process of finalizing negotiations with the relevant mobile network operators for the zero-rated data for both students and staff. Colleges will be making alternative plans to ensure that students receive their learning content whilst the issue of data is being addressed. The TVET college exams calendar will be adjusted to ensure that students are adequately prepared for examinations and assessments and are not disadvantaged in any way. I must indicate that flexibility exists in our TVET exams calendar to allow for any reasonable amendment, so there is no need to panic. Semester 1 and NCV students who are currently in recess shall resume their classes on 12 July on a rotational basis. Semester 2 registrations are ongoing and phased-in classes will begin on the 1st of August, subject to review. Staff attendance at colleges and regional offices should be at a maximum of 33% to allow for limited disruption. But please make sure this is done in conjunction and in cooperation with management. Community colleges, on their side, will be guided by the Department of Basic Education calendar because the majority of our colleges use the basic education infrastructure. Skills development institutions and initiatives. Lockdown level 4, with its stringent measures, will negatively impact on a number of economic sectors supported by the Sector Education and Training Authorities, the SETAs, including skills training programs in the hospitality and tourism sector. As a result, the free flow of skills training in the workplace-based programs like learnerships, internships, and apprenticeships will be slowed down, unfortunately. To mitigate against the slowdown in economic gain and skills training, previous interventions, such as the skills levy holidays on employers and the accelerated increase on the apprenticeship grant, will apply in the immediate affected period, but only where in cases that workplaces have been shut down. In order to assist skills development providers to continue and manage service delivery under lockdown level 4, the criteria and guidelines for the gradual opening of activities, as per regulations of the Disaster Management Act, published on the 29th of June 2020, serve as a framework guiding document which they must apply. Provisions are made with respect to measures that need to be implemented during lockdowns, which include but not limited to lockdown permits, administration, sanitizing, disinfection, deep cleaning, social distancing, health and safety, ventilation, PPEs, and remote multimodal teaching and learning, including remote working where feasible, as I have said. These provisions also apply to all trade test centers. Due to the severity and rapid spread of the current and dominant Delta strain, all skills development providers are urged also to consider reducing physical trainer, assessor candidate interactions within training or testing spaces. Ngamanye amazwi, labo abasezindaweni noma abasemsebenzini ngokuqeqeshwa, sithi nabo abaqhubeke babhekisise, baqhubeke nokuthi bazivikele ngazo zonke indlela, njengokwendlela zokusebenza ekulwisaneni kwethu naleli gciwane. Let me now come on to update on NSFAS laptop distribution. NSFAS has to date ordered 170,000 laptops from the appointed service providers. Of this, a total of 90,060 has arrived in the country and is ready for distribution. The balance will be arriving in the country middle of July and middle of September this year. To date, university student information as per the NSFAS portal has been slow due to universities not timeously verifying student details on the NSFAS portal. A total of 1,846 students' information has been shared with the providers, of which 1,123 has been delivered to 4 universities. That is the laptop delivery, namely the University of Pretoria, University of the Free State, Durban University of Technology, and the University of Mpumalanga. I call upon our universities to contact NSFAS through the NSFAS portal to ensure that they verify their students' information. It is important that universities must prioritize this task urgently. Ubuye ungiphe namanzi we-Ishmael. Ukukhuluma lokho mfowethu kubuye kuqede nezinye izinto la emlonyeni. Manje ke sadalelwa kona ukukhuluma ngaso sonke isikhathi. Ngiyaxolisa, sorry. The TVET students do not order via the NSFAS portal. However, NSFAS will prioritize the TVET students for delivery of laptops. A total TVET listing of 46,846 has recently been shared with the providers for delivery. The provider will contact these students to arrange for delivery as campuses are currently closed. Of the 46,846, a total of 183 has been delivered to South Cape TVET College and 86 for Central Johannesburg TVET. I'm very pleased I was part of the delivery of some of the laptop, the gadgets at the South Cape TVET College. On maintaining health and safety in all our institutions, which is a very important matter, Higher Health has trained and developed over 49,000 campus-based frontline institutional staff and student volunteers. Among them are residence officers on campus, off campus, and private accommodation, management, student support services, campus security, and cleaning staff. And there is nothing as nice as to see those student volunteers of ours saying, first things first. During all the waves, including the current third wave, we have experienced several cluster outbreaks across many of our institutional residencies, which has warranted Higher Health to develop a specific protocol on residences to deal with COVID-19 positive cases. We established isolation and quarantine resources within the residences to prevent further outbreaks in common areas such as dining halls, kitchen, and study halls. Going forward, we'll accelerate daily COVID-19 screenings at residences in order to identify as early as possible any outbreaks. Higher Health will now embark in partnership with all institutional management towards training of resident managers, wardens, other resident staff, including private accommodation, on the resident safety protocol. I therefore urge all our institutions to work closely with Higher Health, which is our own institution, as residences pose a serious risk for COVID-19 outbreaks and ensuring we save lives among our students. It is evident now that the Delta variant is highly transmissible and increasingly infecting larger numbers of younger persons in the population, unlike the previous Alpha variant. It is therefore crucial for young people to take these extra measures and precautions very seriously if we are to prevent community transmission. Our scientists are unequivocal in the fact that social behavior is still the biggest driver of this pandemic. Indlela esiziphatha ngayo kusakhombisa ukuthi yiyo eyenza ukuthi leli gciwane lisabalale ngalendlela. Uma ngabe sikwazi ukuziphatha kahle silandela zonke inhlelo okufanele sizenze zokuyivikela, siyokwazi ukulwa naleli gciwane. Ingakho ke kubalekile ukuthi siqhubeke nokuthi sigqoka ama-mask ethu, nokuthi siqhelelane, sigeze izandla zethu, sifake nama-sanitizer la kufanele khona, nanokuthi ukuthintana kube into esizama ukuthi siyigweme ngazo zonke indlela. Ukuziphatha kwabantu ikona ekugcineni okuyosho ukuthi siyaphumelela yini noma cha ekulweni naleli gciwane. Your social behavior can save many lives. The Higher Health toll-free digital screening tool called Health Check, which is available on WhatsApp and in a web form, provides a comprehensive symptom screening on a daily basis. It also issues a daily passport to enable all our students and staff to screen their COVID-19 status, thus allowing easy access in our campuses. Where I jumped an acronym, Professor Aluwalio, when you get a chance, you will come in and explain whatever acronym I might have jumped. As South Africans, we've got this problem of having too many acronyms, such that there is a threat that we ourselves can actually turn ourselves into acronyms. I urge all our students and service providers to use Health Check before leaving your home or residence in order to look after yourself as well as protecting others. Keeping in mind the new variants that are highly transmissible, even when someone is asymptomatic or mildly symptomatic, and especially in the third wave, daily COVID-19 screening is critical towards saving human lives. Sibuye sikhuluma isingisi esikhuluke okuye kufune sisichaze. Uma kuthiwa asymptomatic kusho ukuthi ulithwele leli gciwane kodwa awuguli, awubonakali ukuthi uyagula. Ikhona leyo ngozi. Ungazizwa ngoba uthi hayi ngizizwa ngikahle, ucabanga ukuthi ungenza noma kanjani. Kanti uphile nje wena likuthinti, kodwa ulithwele uzolidlulisela kwabanye abantu elingabalimaza noma likwazi ukuthi libagulise. Ingakho kuyiphatha kubaluleke kakhulu. Thus far, over 12.9 million passports have been issued through this tool since its launch in early June 2020. In order to strengthen our student health and wellness services at campuses in underprivileged communities, Higher Health again has established District Campus Health and Wellness Mobile Clinic Healthcare Program. Higher Health wethu lo okuyinhlangano yethu esisiza ngokwezempilo kulomkhakha kulemnyango yethu inana namo omahamba nendlwana, ikakhulukazi endaweni ezisemakhaya bakwazi ukuthi bawusiza abafundi noma ngabe bakweziphi ikhungo. These clinics play a key role in various provinces, in managing cluster outbreaks across our campuses. We work closely with the Department of Health, National Health Laboratory Services to enable early detection, isolation, and further mitigating the spread of infection across our residences and campuses. The last matter I want to deal with is on vaccinations in our sector. I have instructed Higher Health to come up with a post-school education and training vaccination strategy that is aligned with and supporting the Department of Health's phased national vaccine rollout strategy. The strategy will help to ensure access to vaccination for all our staff, including academia, management, but importantly our frontline staff at our residences, cleaning, security, and other support staff. This matter has been tabled at the Interministerial Committee on Vaccines, and I'm confident that very soon we will start the rollout of vaccination to all our staff in the post-school system. I will be making an announcement as soon as the Department of Health is able to provide our vaccine doses for our sector. For easy access of vaccinations to our staff and later students, work has already begun to develop vaccination centers within our universities and TVET colleges. You see this thing I was explaining. Our universities and colleges are not just places of teaching and learning, important as that is, but now we are using them as vaccination centers. I'm so proud that thus far many of our universities, like Cape Peninsula University of Technology, which I visited the other day, the University of Pretoria, which I will be visiting tomorrow, the University of the Western Cape, the Nelson Mandela University, and University of Zululand have already become vaccination sites for the public, health science staff and students, as well as pensioners. We are not just vaccination centers for people in our sector, but also for communities out there. Many of our TVET colleges are already serving as vaccination sites for the Department of Basic Education vaccination program for its educators. We are confident that we will very soon be able to vaccinate all our staff in the coming few weeks. Thank you very much, and let us all keep all the health and safety protocols at all the material times. I thank you. Ke a leboga.
Councillor Shnene Minister, I statement sayina. Mitaya mahlweni sweswe. We will proceed with our program and ask the members of the media to give us their questions, and Takalani will read the WhatsApp messages. Unfortunately, we are not taking calls today. However, we have provided all the necessary platforms for the members of the media to engage with us. Taki, do we have any questions on WhatsApp? Thank you very much, Taki. Minister TM, DG, we do not have questions on our statement this afternoon. Ladies and gentlemen, this brings us to the end of our media briefing. Thank you very much for your time. And the statement will be distributed through all the media platforms of the Department of the Government Communication and Information Services. I see, Taki, there's a change of heart. Thank you very much. Is that the only question, Taki? Thank you.
So what are we going to do with the answers we have?
Okay, DG, may I please call you to the floor to give us the response? Thank you.
The deputy minister is complaining. What are we going to do now with all the answers we have?
Yes, thanks very much to the question. Maybe before I respond, let me give some context. When the World Health Organization made a request for us to respond to the call for hosting the hub, a number of private sector partners responded to the call. Two in South Africa, Afrigen, a company based here in South Africa, as well as BioVac, which is a company based in Cape Town, where the state has about 47.5%. They then both responded to the call. So now that the announcement has been made, the two companies are preparing to receive the intellectual property from a number of manufacturers to both Afrigen initially, and Afrigen will play a leading role in then providing training to BioVac and other companies in the rest of the continent. So the question is, where will the hub be based? It is likely to be based in Cape Town. And then how long this is going to take? There are two aspects, just to give the context again before you respond, that are being negotiated at the moment. The first one is to negotiate from the companies that are holding IP for the mRNA vaccine to indicate what conditions they would like to have as part of the knowledge and the technology know-how to these two South African companies initially. Our estimate is that it will take about 3 to 6 months to have those negotiations concluded. And then the second aspect is for these two companies to start preparing for the, if you like, receiving the technology know-how to their site. So in other words, this is the training that will be provided. This will be buying the equipment to then produce vaccines. And we anticipate that this will take about 6 months plus minus. Thank you very much.
Thank you, DG. Dear, maybe let's try once more and check if whether they are, so that you don't go back home with your answers. Taki, any luck? No. Okay, DM, unfortunately, we are going to go back home with the questions. Ladies and gentlemen, as I've said earlier on, this brings us to the end of our media briefing. Our message is very simple, what the minister has been saying in detail. I will say it in Zulu, ukuthi faka isifonyo, ubogoma, uqhele, uphinde futhi uhlale ekhaya. Thank you very much.